as of 6 p.m. Yesterday, you would see that we also divided the reporting among the two vaccines that we're using now. CoronaVac is the Sinovac vaccine, and AstraZeneca is, of course, the other vaccine that we are using. And as of March 17, 2021, sa CoronaVac, we've had accumulated natin almost 168,000 people have been vaccinated using CoronaVac, and AstraZeneca 72,500 have been vaccinated. So all in all, we have vaccinated as of yesterday a reported number of 240,297. This is the data from our deployment system. So out of those who have been vaccinated sa CoronaVac, after 168,000, there have been 3,700 reports of adverse events following immunization. Most of them are mild, non-serious events, 3,600. And then we had 83,000 serious adverse events, which I will give you a little more description later on. And we had the report of the one death under the Sinovac or the CoronaVac vaccine. So all in all, yung AEFI reporting rate ng Sinovac is about 2.21%, meaning 2.21% of those who were vaccinated reported and sent in a report of feeling something after their vaccination. Sa AstraZeneca, about less than half pa ng CoronaVac ang na-vaccinate with AstraZeneca, about 72,000, and they have reported about 3,769 adverse events. Most of them, again, are non-serious, 3,715, and there were 54 flagged serious adverse events. But in total, the adverse event reporting for AstraZeneca is about 5.19%, a little higher than CoronaVac. But these are all, of course, within the expected number of AEFIs, because in the clinical studies, of course, mas active yung AEFI seeking nila sa studies. Really, maybe 20-30% of people who get vaccinated feel something, some mild irritation, some mild pain, or up to severe adverse events. So yung 2.2% and 5.19% is expected. And kung total, if you put them all together, our AEFI reporting is 3.11%. So we collect this data every day and see if we see any clustering or if we see any unusual events. And so far, wala naman tayong nakitang anything unusual. And of course, yung one death, if there is one severe adverse event, especially death, within 24 hours, this is reported, of course, to the all the data is gathered and all of the information is taken, and then this is referred to the NAFIC, to the National AEFI Committee, for them to assess it. And in this case, it was assessed to be a death due to COVID-19, knowing, of course, that a patient who has been vaccinated can still get COVID-19, especially in the early part. So it was deemed na hindi naman siya anything unusual. So when we say that suspected adverse reaction is serious, it must meet the following criteria. Number one, it results in death or a life-threatening situation that the patient had to go through management for a life-threatening situation, or an adverse event that requires inpatient hospitalization or results in prolongation of existing hospitalization. Pwedeng nasa hospital na siya, and then the vaccination might have caused something to make that stay a little longer. It is something that results in persistent or significant disability, results in a congenital anomaly or birth defect. Ito siyempre mga later on pa naman, wala namang mangyayaring immediately na mga ganyan, or is a medically important event or reaction. So if it's enough to cause the need for medical attention, especially hospitalization, then we recognize it as a serious adverse reaction. So yun yung mga serious adverse reactions na nakalista doon sa kanina.